Thanks very much, Maureen. And I too would like to acknowledge that I'm giving this talk from the unceded land of the Musqueam, Tooth, and Squamish peoples. And I'm at the Mount Pleasant, which is the mouth of the Fraser River where the salmon used to run. So thank you for having me, and thank you for all of you for participating in what is our first virtual BC Kidney Days. And so I'm going to remind, because not all of us at this conference, some of you are new. So how we serve British Columbia is through a number of different ways, and we actually have 6 health authorities, 5 geographical and 1 PHSA with children's. We have a number of different community centers, dialysis centers, kidney care clinics, and community dialysis facilities. And it's important that we understand that in a distributed model that actually brings everybody together. Next slide, please. We have a provincial committee structure with 13 multidisciplinary clinics, which are important to do. These are cross-health authority and multidisciplinary. I think that's really important for us to notice, including the fact that we have patients on most of those committees and are working towards doing that. We actually have annual work plans and actually include research, quality improvement, and evaluation in all of those at the essence of the way that we actually do business with those provincial committees. Next slide, please. We had a strategic priorities exercise aligning with the PHSA a couple of years ago, and this is our 5-year plan. We're trying to optimize the patient experience, have innovation and research in all that we do, have sustainable funding situations and the right technology solutions within a sustainable renal community. And I think all of those words and aspirations are things that really guide the way that we do business. Next slide. Our COVID-19 response is testimony to the fact that the way that we had structured everything at BC Renal actually paid off. We didn't have to do any restructuring because we had our committee and our medical director structure inherent. And I thank my colleagues for tirelessly working within each committee, in each health authority, under the medical director leadership to really make sure that we got our guidance documents together, good communication with the patients, some very innovative ways to address potential shortages. We didn't have any, but we could have. And these were things that are quite important for us to recognize as a community that we were able to come together, and that included across all aspects of kidney care. Next slide. We importantly, after 1 year of truly attempting to ensure that we have patients who we've always served, but now intricately involved in all of our activities. We have 61 patient partners and 24 different opportunities. We've got patients in all of the different aspects of things that we do. And I think we're very proud of that. And that's under the amazing shepherding of Helen Chu and her team, and all of the others who are truly committed. And I think that really is testimony to our enabling of the best care, best experiences, and that most of our patients actually are experiencing a lot of, sorry, I'm losing my word, but our patients are very committed to helping us to make the committees and the work that we do better. And I think that that's very sobering for all of us. Next slide, please. So in addition, we have a number of initiatives for early identification and prevention, and I don't have enough time to go into all of them, but this slide describes those. We have online kidney assessments, Facebook campaigns, and TV ads, as well as the bus ad last year. I urge all of us as a community to make sure that we know all of these things that are going on, and remember that March is Kidney Month, which we'll come to. Next slide, please. We continue to innovate and do research in kidney care, be that clinical trials, administrative research to help learn with and from our patients and our experts in various methodologies. This is a slide that just describes our publication rate as well as our clinical trial involvement in both kidney and transplant world. And again, this is something that we should all be very proud of. And I urge you to go to the e-posters to make sure that you see some of the real-time work that's being done by our entire community. Next slide. We are responsible for almost $200 million in our renal budget for the province of British Columbia. I'll remind you that that goes to the majority of which goes to direct patient care across the continuum. We fund all medications in a very accountable and transparent way. That's very important to us, that we know where every dollar goes, and that we have a number of provincial vendor contracts to make sure that we optimize the dollars that we've been given. And I think we're quite proud to say that of our total budget, less than 8% of it goes to any kind of administrative support, which is, again, testimony to the lean structure that we have. Next slide, please. We have Promise, which is our provincial information system. We have 609 users, and you can see all the stats there for yourself. I think that Promise is one of a number of important information systems in the province. It's important that we acknowledge the value of this Promise system and all the people that work to make us have information in the moment that helps us with patients, as well as during pandemics and emergency situations. That information is critical for both reporting up, for funding, but also for ensuring patient safety. And I urge you all to look as Promise is updated and refreshed and renewed. If you haven't visited it for a while, especially the clinicians in the group, you should. It actually is more and more user-friendly over time. Next slide. So we do have a sustainable renal community. We have BC Kidney Days. We have a number of initiatives with CKD education. We have province-wide rounds. There are so many things that we do to enable and ensure that all of us are able to learn together in a number of different fora. And I think that, if nothing else, the pandemic has certainly made us all more available to be able to listen to these things. And I can say that we've learned a lot over the last while, not just in terms of COVID, but just some sharing with experts across the world in terms of kidney care and novel methodologies, etc. Next slide, please. We have a number of different ways that you can stay connected to BC Renal, Facebook, the website, which has been downloaded from across the world in terms of some of the items there, including patient-facing materials and provider materials. We have an active Facebook account, so please make yourself very familiar with the different ways that you can stay connected to BC Renal. Next slide, please. We do have a Key Accomplishments 2021 that we're going to put together an annual edition of. So when that comes out, please do look at it. I think it tries to highlight all of the world, all of the work that people are doing to make sure that we keep our community strong and our patients and providers healthy. And I'll just end with the fact that, next slide, please, that our main raison d'etre is to improve the quality of life and outcomes for all of our patients. And so we really continue to be able to boast that we do have some of the best outcomes in the country, that we have the highest amount of people on home-based therapies. We have a number of initiatives to improve transplant first initiatives, and we have an integrated information system, and we have patients at the crux of everything that we do. So with that, I'd like to thank all of you as a renal community for continuing to work with us and for our patients. And I'd like very much now to hand over to Eric Lunn, who's the new-ish Provincial Executive Director of BC Transplant. Eric, over to you.